598. Overall, over 2 million people across Nigeria are living with HIV, underscoring the need for ongoing prevention, testing, and treatment efforts. Lagos State ranks 4th with 108,649 cases, while Anambra and the FCT also report high numbers. Other states with significant prevalence include Delta, Imo, Enugu, and Taraba, while states like Kwara, Yobe, and Zamfara have the lowest recorded cases. The data was obtained from the National Agency for the Control of AIDS, NACA, through the latest HIV spectrum estimates. Okay, you can tell this is troubling, it is unsettling, it's a lot of things, and we need desperate solutions. My guest is Professor Kingsley E. Douglas, a consultant, occupational and public health physician. Professor Douglas, are you there?
I am. Thank you, Sam, for having me. Greetings to the public.
Thank you for making the time. All right, so straight to business, because we don't have a lot of time. You've seen the figures. River State, for last year, according to the report from NACA, we have the highest HIV rates in the country. What do you make of these figures?
Well, shocking as they may appear, but it gives us a period for introspection. It gives us a time to reorder our priorities. It gives us a time to look at what really counts. Let's not just start with River State. Of course, there is a national average, and we were at some point having a retrogression in terms of prevalence. We also had some successes, okay, and these successes were celebrated. But the figures being reeled out now gives us something to worry about, especially we who are in the healthcare delivery industry.
Mm-hmm.
Now, let's look at River State. Now, some time ago, River State was, in fact, among the ones that ranked on the bottom. But gradually, this has gone up. It's not because hell was visited on the state, if I may put it that way, but it is that we have let our guards down. The structures, the institutions, apparatchik, call it whatever you will, that were in place that give us what we are looking at. Because the data we're talking about is from no less a group than the national NACA, National for the Control of AIDS.
Yeah.
So that's a very reliable piece of data. So I think what it is a wake-up call. Those of us in the public health sector have got to now realize that we have dropped the ball, and we need to now pick it up and run with it and start those things we did and even intensify them to making sure that we change what we have now. Just as it is very important to change what it is at the national level too, all over the country.
Well, I'm not hoping that any state is number one. This is a record nobody wants to break. But I'm struggling to come to terms with the idea that River State has higher numbers than Lagos. And it's not because I don't mean well for Lagos. It's just owing to population difference. Why would we have higher numbers than a state that has more people than we do?
Okay. I think you mean well, and it's a very fair question. Now, you see, HIV or AIDS tied to poverty. HIV or AIDS is tied to unprotected and recalcitrant. I like to use the word recalcitrant sex. And indeed, the others that we know, the use of sharps and all whatnot, on-screen blood and all whatnot. But you see, it still gives us a picture that something is wrong. Let's start with poverty. Something is wrong with the cash in hand cash in pocket level of the state. Now, you will recall in a not too distant forgive me, listeners, if I go towards poverty, because the contraction of this disease is seriously and unambiguously tied to poverty. Made a lot of businesses in the last, call it 15, 20 years, have left the state. Now, where did they go to? Because they went to Lagos. So, pound for pound, naira for naira, like I always say, then you have seen the economy and the GDP of Lagos rise. If I'm to compare GDP and Lagos and now, what has that got to do? Buying power, earning power. And look, it is easier to purchase sex for recreation in River State than in Lagos. And I make bold to say it is cheaper to purchase it. Yeah. And what is driving that ability to do so? Poverty. So when we talk about insecurity, we talk about lawlessness, and we talk about the state of emergency we are looking at now. These things have ripple effects. They have ripple effects. You drive businesses. When you drive businesses, you take away money from people's pockets. They become poor and they resort to all kinds. I can tell you, every day in this state, a new lounge, a new so-called nightclub, a new gathering place to drink and do whatever rises. When people are busy in Lagos or even in other parts, creating businesses that will put money in the hands of people so that they don't have to beg. They don't have to do so. That is one. Two, aside poverty, what about the people themselves? How many times have they come to you, Sam, on the studio? Have you heard the radio jingle for the contraction of it? I know there was a time a particular brand of condom. I don't want to give them free commercials here. How many times? Those things have gone and they didn't disappear because they had to disappear. Disappear because business disappeared. So we are not doing enough of sensitization. We are not doing enough of health education. Now, we must put our money where our mouth is. I know these days. God of Sir Peter Odili, I can tell you, he took that bull by the horn. He first HIV, like, in fact, there was a HIV death officer, practically in every local government area. I was just a very young doctor at that time. And they followed this up in the treatment, they followed in the testing, treatment, and further management of these people. And there was a downward trend. But after that era, how much of it have we sustained? Have we even had a health center that is working and all that? So you can go on and on. And of course, please, and of course, this one is very important. Our youngsters who refer to themselves as Gen Z, okay? When you have a population where nearly 50% is under 30, no work, nothing. What do they do? They go to drugs. You can also contract it from use of reused needles. They go to prostitution and all that. So these are the factors. But on top of all this, I dare say, and I remain to be corrected, poverty is at the top.
Okay. Prof, we are very close to running out of time, and I know that you have to get back to what you have. So very quickly, for solutions, what must we do for testing, for treatment, and to ensure that we're not breaking this record next year?
Very simple. We should face economy. The economy of the state has to be revived, which means allow a conducive atmosphere for business. I'm not a politician. I've never been one. But politicians to allow to shape their thoughts, allow businesses to thrive, so that there will be money in people's hands, and easily purchased recreational sales will be reduced.
Okay.
Second, there must be health education of the populace, both in the all print, electronic media, pamphlets, all kinds. Even I know in the days of between 1990 and 2007, they had town criers go around. The people in the ministry, that is those who are in the religious sector, and we'll leave with you. Some too, you have to talk to your management, and indeed every other management of any media. We have to intensify our efforts in educating people. Now, after that, we must encourage testing. Because the drugs for HIV is for you to lead a nearly normal life. These drugs are there. If you don't more, it's death sentence. So we encourage testing so that people are tested, and when they are found, they assume treatment as soon as possible, and we follow them up to make sure they assume treatment. So they continue treatment for as much as that was. So these drugs must be available.
Okay.
And they must be accessible. They must, of course, thank God for the likes of our former President Obasanjo. They must be not just accessible, but easy to purchase. And I think that is not the problem. So if we call it a problem, we can easily start bringing that down. Then we have to, again, talk to ourselves. What is there? If you are not ready for sex, wait for your time. If you are ready to do it, use protection.
Okay.
There is something wrong in a girl bringing protection herself inside her purse. There's something wrong in a man carrying his phone too. Those who make these condoms can help us as part of their community
Yes, sir.
service.
Corporate social
Make
responsibility.
it available everywhere. I've been to public toilets outside of this country where every toilet, as you walk out, there is a pack of condoms to use, and there is a message that tells you that mutual fidelity is the best protection.
Okay.
And of course, government must be able to spend in the training and retraining of those who are also vested with this job to make sure that they carry out. Not just training them, pay them. Of course, recently we had health workers are already angling for respect in the local government areas.
Okay.
So if we look at this, we'll be able to make a headway. But first, politicians should please let us read.
All right.
And allow businesses to start. Thank you.
Thank you very much, Professor Douglas, for your time. We appreciate it. Have a wonderful day, sir.
Thank you, Abby. Thank you.
All right. That was a consultant, occupational and public health physician, Professor Kingsley E. Douglas. After the break, you and I talk. What do you make of this stat, these figures by NACA, and is sex education a taboo in your community? Stay with us. Hard Facts 92.3 Nigeria Info. Rivers State records highest HIV rates for last year. The 2024 HIV data from Nigeria reveals that Rivers has the highest number of people living with HIV with 208,767, followed by Benue, 202,346, and Akwa Ibom, 161,597. Overall, over 2 million people across Nigeria are living with HIV, underscoring the need for ongoing prevention, testing, and treatment. Lagos ranks 4th. Anambra and the FCT also report high numbers. Others with significant prevalence include Delta, Imo, Enugu, and Taraba, while states like Kwara, Yobe, and Zamfara have the lowest recorded cases. Now, it's important to know that this is for 2024, and these are recorded cases as published by NACA, which is literally the official HIV/AIDS body out of this part. So definitely you can take those figures to the bank or wherever you prefer. So my question is, with the few minutes we have, what do you make of these figures, this data? And is sex education a taboo in your community? Or on a personal level, is this something you have inculcated? I'd like to know. Because when it comes to the subject of teaching and talking about sex, people have a certain position towards it. But now more than ever, even beyond HIV, for the ethical, morality, and all reasons attached, it's important that you're sex aware. 0817-923-0002. Hello, good evening.
Oracle.
Good evening. What's your name?
Yeah, Comrade Clayton calling from Bori.
All right, go ahead.
Indeed, these figures are alarming.
Truly.
Very alarming. I don't even know what we are going to do. You talked about sex education. Is it helping?
It has to.
Because it's not helping, because it's not that they are not aware. It's not that the children or even the elderly ones are not aware. They are aware of these dangers of having unsafe sex or even using sharp objects. So that's how HIV is transmitted. But again, they still go ahead and do these things. Most, especially the younger generation, call themselves the Gen Z or what they call themselves. They don't want to listen. Again, there's another political undertone to this, because some states, I've been hearing rumors that some states inflate their figures so they can get aid from foreign countries. If that's the case, I don't think it's a good one, a healthy one. But we must all protect ourselves so that we don't harm the next person next to us. Thank you very much.
Thank you very much. Well, it's important to note that these figures are from NACA, right? So it's not population census. It's not people just adding figures. These are based on verified tests, people who have tested positive. It's like when a lab tells you that there was one stat that came out one time. Yes, around, what's this thing called? Oh, the testing to know if your child is your child. What is happening to my mind? That test, you do, is it DNA? The one you go and take your child to know if it's really your child. So there were labs that published data stating that a lot of the children who ended up not being for the husband of the woman, a lot of DNA frauds, I think, were with first children. And people were disputing, and they were like, based on the tests we've conducted, if we've conducted 100 tests in this lab, 80 or 90, it is the first child that was disputed. DNA test. Thank you very much. So these are based on verified tests. Progress from LLA. Hello, Progress.
Hello, Sam. Good evening.
Good evening.
Let me begin by saying that the report coming up that River State is ranked the highest, I think is a worrisome one.
It is.
And something certainly must be done. Let me say that in the early 2000s, just like our guest stated, there was this massive awareness on HIV and AIDS. But now, it's very poor. And I want to tell you that one of the major reasons for this is in our localities, people are not aware. Even when they are aware, they appear helpless. They want to do, but there is no material for them to help themselves, to protect themselves. If these things are made available to them, some of them will be willing to do it. In fact, I want to say that some of these people that are in the rural areas, some of the major part of this report is coming from the rural setting. And I want to give credit to the Ministry of Health, those who collected this data. And I used to see them in local villages collecting data. And I think that more can be done. Not only collecting the data, but educating these people and providing what is needed for them to protect themselves. And I don't believe that Lagos State would have even ranked the first if you talk about the space of economy. But I think that more has to be done by educating churches, all these bishops and overseers generally. They should take this thing as a project of sensitizing their members each time they hold microphone. And not only churches, but organizations, chiefs, and our government should pump money. They should support this project to reduce this number. We don't want to hear this kind of report. This thing is
all right.
Thank you very much, the Radio Council.
Thank you, Progress. God's Time from Onelga. Hello, God's Time.
Yeah, good evening, Samuel.
Good evening.
Pathetic.
Indeed.
Worrisome. Sad. And I'm even dumbfounded. You see, when I was in secondary school, far back then, I can still recall that there was an awareness program organized. We are sensitized, we are told what to do and not what to do to prevent. Most people think that it's just HIV. There are other sexual transmitted disease that is even more dangerous. But still, the one that is worrisome or the one that is being discussed is HIV. I think people should be able to understand that even while you want to enjoy, there should be need for proper protection. For that need for you to do the needful to keep yourself alive and other persons alive. If you have not seen someone who has it, you feel it's just a rumor or this is just a news being aired. But reality is with us. The question is, what do we do next as a state? There should be a program from the government, the Ministry of Health, River State, to the locality. Let there be even distribution of protection. And let there be proper awareness of what the danger holds ahead. The future is at the unborn generation. And when this generation are affected, what do we think that the unborn generation will face? The government should take proper care of this situation. Because with this statistic, head we get loose. Not just now, but tomorrow. And the doctor who spoke with you, he said, establishment of various large clubs and the rest of them. You see, most people don't even sleep at home. You see them in the morning, they say, go ball. And at the end of the day, in the spirit of highness and enjoyment,
I have to go now.
Do unnecessary things.
Thank you very much. I'm down to my final minute. Okay, well, the idea behind this is so that we can plan appropriately. These are not good figures. And it's not just about the fact that it's River State. No state really should be on this. I remember, as a few callers have attested to, during the Obasanjo administration, it was almost as if all the governors were having a competition to drive down the numbers of people contracting HIV. The awareness was heavy. The treatments, prevention campaigns, it was major. I know of Cross River State. I know of Lagos State because around that time, while traveling, you could test for HIV anywhere, and those figures went down. Well, now that we have this, it's important that we act accordingly, so that we're not breaking this record again next year. Thank you very much. Our program comes up now, and the news happens at 6. Stay with us.
Law 1